Representing Lebanon VA is our ninth director, Robert W. Callahan Jr., who is one of three tenured directors at the medical center here in our county, and also Dr. John Halkovich, who is the acting chief of staff and in charge of Rex and all our other physicians right now.
Excellent. Robert.
One of the things that I'd like to say is we've been here for 70 years in Lebanon County. That's just in Lebanon County, but care for veterans hasn't just happened for the past 70 years in Lebanon County. It's happened since the beginning of Lebanon County. From a national perspective, care for veterans actually started, anybody know when?
With the Colemans.
With the Colemans?
Well, locally.
Locally. How about nationally? Anybody have an idea when the first record of caring for veterans came about?
William Penn.
You're really close. It was actually the Plymouth colonies. There was a proclamation to care for our veterans who defended our Plymouth colony. So that's when veterans care really started. It has evolved many times since then. But as the ninth director at the Lebanon VA, I've been here 10 years. As Doug said, I'm the third most tenured at this point in time, come November. So I've been blessed to be here. This was my second trip. I started as a staff member back in the early 90s, and over almost a 30-year government career and been all over the state. This is my favorite place, and I asked to come back here. I started my career in Lebanon. I'd like to be able to end my career in Lebanon. But we've seen many changes over time, and I think Dr. Herbert alluded to that. We've seen unprecedented construction in the past 10 years, preparing for the future. We've had many mission changes during that time, and we have had many new priorities, which brings me to my next thing, and what I would like to also do is partner with you all here in our county. To be there for veteran suicide. September's veteran is Suicide Prevention Month, not just for veterans, but across America. So what we have is a, Doug, do we have,
yes, sir.
That's out here? Okay. What I would love to do is have everybody sign our proclamation to partner and help prevent veteran suicide. Okay. We have a lot of tools available that all we need to know is how many do you need? They are laminated sheets that we would love for you to give out to all the county employees, so they have awareness and they know what to do, whether it's a veteran or whether it's a civilian who's running into challenges. It gives them specific things and steps that they can do to avert depression and suicide. There's also buttons and refrigerator magnets. We did an employee appreciation luncheon that we do every year. Yesterday, we gave out refrigerator magnets. I can tell you that there is not a steel door jamb in the Lebanon VA that does not have at least 2 or 3 of these things on them already. So you can't go through any door without seeing a reminder of being there for veterans. And that's one of the things that we would like to be able to do, is put that out throughout our entire catchment area. The goal would be everyone who lives there knows exactly what to do. Or if they don't, they have the ability to look on a simple button and say, oh, here's a number I can call and somebody can get immediate help. Okay. So immediately following this, I would love to leave this with you. We sign it, pass it through all of our county employees, and let's get more information out of how we can reverse the epidemic of suicide, especially in veterans.
That's a nice other layer of emphasis on this month with what the county is doing and through our department that is in charge with watching, monitoring, and educating and making people aware of the issues. And I think what the takeaway from last meeting was that the profile is so dominant in Lebanon County for suicides with it's male, middle-aged, Caucasian, and in firearm. I mean, that's such a dominant profile. I think of the 9 that we had, or the 10 that we had, 9 were that profile. So that's what's, the folks that you see are troubled, and just be more aware of people around you. Anything else? Proclamation?
Sure.
Whereas the Lebanon Veterans Administration Medical Center is celebrating its 70th anniversary of service to the veterans of South Central Pennsylvania. And whereas the Veterans Hospital admitted its first patient on September 15th, 1947. The goal of the hospital remains unchanged, caring for our nation's warriors. However, the methods of care are constantly evolving. And whereas the original facility was a 501-bed inpatient psychiatric hospital, it was later expanded to a 1,100-bed psychiatric hospital and long-term care facility. The local medical center is home to one of the most advanced surgical centers in the VA. It is also home to a nationally showcased residential rehabilitation program. And whereas Lebanon VA Medical Center is one of 168 medical centers in the nation with the sole purpose of providing world-class medical care to America's veterans. Lebanon VA Medical Center serves a 9-county area in south central Pennsylvania covering Adams, Berks, Cumberland, Dauphin, Lancaster, Lebanon, Perry, Schuylkill, and York counties. Whereas the Lebanon VA Medical Center continues to be a benchmark of excellence and value in health care and benefits by providing exemplary service that are both patient-centered and evidence-based. Now therefore, we, the Commissioners of Lebanon County, on behalf of all our residents, first of all extend our appreciation for your service and do hereby recognize and offer our congratulations to the Lebanon Veterans Medical Center in honor of their 70th anniversary as they continue to honor America's veterans by providing exceptional health care that improves their health and well-being.
Seek a motion.
So moved.
Second.
It's moved and seconded. And the only thing I'd like to add is I appreciate Doug and Bob, the relationship that we have with the VA, the county, and the other medical entities in our county. It's a great communication and relationship effort on all sides of this thing. And the only other comment I'd make is that the Center of Excellence that you have out there under your steady hand has been well recognized nationally, and so we appreciate that light being shown on Lebanon County through your efforts. So thank you. Okay, yes.
I just want to say, Bob, in the last couple of weeks, I was able to go through some historical photos filed with the Pennsylvania Historical Museum Commission for a presentation I was doing. And I always knew that original building was beautiful, but I learned that it's on the historic register. So the VA goes back in time and has a very articulate history posted on the state website for anybody who hasn't seen that. You just follow a whole series of wonderful administrators. Leonard Washington is another that comes to mind. And you know, we're just so proud and so grateful to have the military in our backyard. You guys, the Gap, the Armory, and even Rob Callahan, our Director of Veterans, we just have a really good core of people. You're our largest employer, and you serve us proudly and well. Thank you.
Thank you. I was going to say the amount of construction that we're doing around our historical buildings has been a challenge over time, as you all have known and seen. But one of the things that we pride ourselves in is maintaining our historical front. Because that's what our veterans have known and loved about the Lebanon VA. And when we've done modernization efforts, we've worked around that. And I think it's an important statement. So Bob, one of the things you had said is, with the partnership that we all have, and Joe Ellen, you know, God help anybody who attacks Lebanon County with the Gap on one side and the VA on the other. It's the wrong place to come. But you know, when we came in, it was very clear of the partnership that we actually have. It's more like a family. And frankly, it is. And that's one of we integrate well into the community. We continue to plan on doing that for the near future as well. Thank you all.
Thank you.
Thank you. Doug, anything you want to add?
What was the figure, sir, of how much construction?
Well, not only construction, we were looking at some of our historical figures. We were doing that just during my tenure, over the past 10 years. The amount of economic figures that have come through just the Lebanon VA totals up to $2.5 billion in salaries, in purchase care that the Lebanon VA adds back to the community. That's clearly a lot, but that's just one monetary figure. When you're the largest employer, most of our employees have some form of public or volunteer effort. So we're currently, you know, we're proudly involved in the community, whether it be through the VA or through our employees associations. So we are very much ingrained. And you don't find that in a lot of VAs across the country. I've been to 47. I've seen many things. Every time somebody comes back to Lebanon, they say, you know, there's just something different about this place. And we just sit and we smile, and we know what it is. Yeah. Thank you.
So after the vote, sir, if I could get a picture with
Yeah,
the
go ahead.
three of you, that'd be great.
I just have one more comment to piggyback on. You got to it before I did, but obviously the VAs across the country, and certainly not all of them, but there's a lot of bad press and you know, associated with it, and waiting lists and poor care. And I'm always proud to say, not here in Lebanon, and that certainly goes to the success of you folks in managing the hospital, and hopefully the folks from our area that work at the VA helps make that possible. So I say congratulations for the reputation that our VA has here in Lebanon County, and keep up the good work. Thank you.
Bill, if I could tag on to that, and you know me, I always have to try to get out the facts that I can. One of the challenges that we have, and it's healthcare in general, whether it be VA or whether it be private sector, I'd venture to say everybody has a waiting list. But VA is the only healthcare organization, frankly, in the U.S. that publicizes its wait time data. We're not perfect. We care for 44,000 veterans in our area. They came from 52 states last year. So, you know, our veterans came from all over the place. They specifically came to the VA in Lebanon. And we had almost 750,000 visits. Somewhere in there, something didn't go right. And when we find that, our job is to tell our veterans about it. You know, make it known. And oftentimes that puts a VA in a spotlight and in the paper. But we sleep better at night because our veterans know what actually happened, and we're working to make it right, as opposed to not necessarily telling everybody everything. So we're very different compared to a lot of other organizations. In Lebanon, we still have longer waiting times than we need to. But the important thing is, if somebody needs care right away, we have same-day access appointments, so we can get somebody in. We have same-day urgent care. Everything else is scheduled. Okay. But when we have somebody who really needs the care right now, we get them in the same day or the next day. Everything else is scheduled. So when you publish your wait time data, expect people to use it for whatever purpose they choose to do. But Bill, thank you.
No, thank you. Did we vote on it?
No,